Come in.
Hello, hi Carlos.
Hello.
My name is Gissy. I'm one of the nurse practitioner students from South University, and I'm gonna be conducting a head-to-toe assessment on you today. Is that okay? I'm gonna go ahead and wash my hands really quick, and I'm gonna come back to you, and we have some privacy. And I'm washing my hands. Okay. All right, so I'm gonna be doing a head-to-toe like I said before. I'm gonna be looking, inspecting, palpating, auscultating for any possible lesions, masses, or things that you may have. Is that okay with you? If you feel uncomfortable anytime, just let me know and we can stop the assessment. So before I came in, Carlos' vital signs were taken. His blood pressure is 120/82, pulse 72, respirations 18. Carlos weight 200 pounds and his height is 5'9", so his BMI is 29.3. Also his vision acuity was checked with a Snelling chart and he's at 20/20. So now I'm gonna go ahead and start my assessment. I'm gonna start with your head. So I'm going to palpate your head for any lesions. I'm just touching your scalp and part of your head just to make sure you don't have any bumps or lumps, and I can see your hair color is light brown. You have a little bit of alopecia, but hair distributed, otherwise it's even. There is not visual lesions, and your skull is cephalic. So I'm gonna go ahead and move to kind of assess. I'm assessing your skin color. There's nothing on your neck. Everything looks normal. So I'm just gonna ask you to clench your teeth, and I'm gonna go ahead, clench your teeth, and I'm gonna push on your chin up, and I'm just assessing for any tenderness or pain there when you do that. I'm just assessing for temporomandibular junction just to see if you have any TMJ. I'm gonna also palpate for your temporal arteries. Okay, perfect. Can you raise your eyebrows for me and smile? So I can see his facial expressions are even and equal, and we're kind of checking here for cranial nerve 7. So I'm just gonna go ahead and do, we're gonna move to your cranial nerves. So we're gonna check your cranial nerves. For that, I'm gonna turn the light off so we can assess cranial nerve 2, 3, 4, and 6. Ooh, that's kind of, okay, we're pretending the light is off. And what I want you to do, I want you to look straight into my light. Perfect. So I'm checking for cranial nerve number 2. Okay, just look here on my shoulder. Perfect. All right, so I'm gonna check for consensual, which is cranial nerve 2 and 3. And what I'm gonna do, I'm gonna just pass the light, and this is with the light off. So I'm passing the light on one eye. So his pupil should dilate, and the pupil on the other eye should do the same. That's called consensual. So they're dilating. I'm just gonna do the same on the other eye. Perfect, perfect. And that's cranial nerve 2 and 3. I'm also gonna check for cranial nerve 4, 3, 4, and 6, which are the eye movement. So for that, we're gonna do something that is called the 6 cardinal points of gaze. So what I want you to do, you're gonna follow my finger everywhere I go. So I'm gonna trace an H. Perfect. Perfect. And that's telling me that he's able to follow my finger. So his cranial nerves, the movement of his eyes are intact. I'm also gonna check for peripheral vision. So what we're gonna do here, cover one eye, so it doesn't matter which one. And can you see what I'm doing? Okay, perfect. We're gonna do the same thing on the other side. Can you see what I'm doing? Perfect, great. So we did check for cranial nerve 2, 3, 4, and 6. Cranial nerve 1 is the olfactory, so for the purpose of this, we're not gonna check that one. That's just to check your smelling sense. We're gonna check for cranial nerve 5 and 7, which is going to be on your face. So for that, I want you to raise your eyebrows again, puff your cheeks out. Perfect, perfect. And what I'm gonna do for the trigeminal, I'm just gonna check for sensation. So I want you to close your eyes and you're gonna tell me when I'm touching you if you're feeling sharp or kind of dull, okay? So. Sharp or dull?
A little sharp, but
okay. Sharp or dull?
the same.
Sharp or dull?
A little sharp.
Okay. Here?
Same.
Okay. So now you're gonna tell me. Sharp or dull?
Dull.
Sharp or dull?
Dull. Same.
Perfect. So cranial nerves that are intact. I'm going to now we're gonna check for cranial nerves 9, 10, and 11, which are on his tongue. So those cranial nerves are the glossal, hypoglossal, and the vagus nerve. What I'm gonna do with a tongue depressor, I'm gonna have you stick your tongue out for me. Say ah. And I'm gonna stick it a little far so you're gonna gag, and we're checking for the glossal, okay? Okay, so the good gag reflex. Since I'm here, I'm just gonna go ahead and check inside his mouth cavity. So I'm just gonna be checking for any lesions. So I can see his mucosa inside the cavity. It's pink, moist, and not and intact. Dentation, it's fine. Uvula, it's midline. Tonsils are +1. Perfect. So now I want you to move your tongue to the side, stick it out, move it to the side. Perfect. And we also can have a glass of water, have him take a sip of water and swallow just to kind of check that. We're gonna go back to your eyes, and what I'm gonna do, I'm gonna check for something that is called red reflex. So what I'm gonna do, I'm gonna look really close into the fundus of your eyes. For this test, we should have the light on, but for the purpose of this, we're just gonna pretend that the light is on. So what I'm going to do, I'm gonna look inside, really close inside your eye. And we're gonna do the same thing on the other side. Perfect. I'm able to see his red reflex with the yellow halo, and his veins and arteries inside the eyes are intact. I'm also going to depress your eyelids just to check your conjunctiva, and it's nice and pink. Perfect. So I'm going to take a look now into your nose. So what I'm looking now, I'm gonna take a look inside your nostrils just so I can see. His septum, it's not deviated, so I'm just gonna look inside his nostril. I'm looking again for any bumps, polyps, any irritation. So his turbinates are patent and they're pink, nice and pink, so that it's perfect. I'm sorry about that. So now that I did check his nasal cavity and his mouth, I'm gonna kind of move on to his ears. So I'm just looking, again, doesn't have any deformity, ears look even and bilaterally. I'm just gonna go ahead and check inside your ears. I'm just gonna be looking for your membranes, your tympanic membranes. So I'm gonna pull the pinna up and back. And I can see on his left ear that membranes are pearly gray, which is normal. And I'm doing the same thing on the right. Perfect. And I can see his tympanic membrane and his pearly gray, and the cone of light reflects on the right at 5 o'clock and on the left at 7. So everything is perfect there. So from now I'm going to kind of assess your lymph nodes. And